Hello, I'm Dr. Anil Gudi from Fertility Plus London, and today we're talking about the most common and challenging situations in IVF, treating women with advanced maternal age, usually meaning 35 and older. A large new systematic review and meta analysis has pulled together 151 studies published between 1995 and 2024, all focused on IVF in this age group. The question the authors ask is simple but crucial. Can we add extra drugs or lab procedures just because a woman is older, or do we really improve her chances of taking home a baby? They looked at almost everything we do in the IVF lab and clinic: different stimulation protocols, different FSH products, adding LH, using growth hormone, choosing various trigger strategies, deciding whether to freeze all embryos, using ICSI instead of standard IVF, doing assisted hatching, growing embryos to a blastocyst, deciding how many embryos to put back, doing pre-implantation genetic testing for aneuploidy or PGTA. The headline message is that age alone is not a good reason to pile on interventions. For stimulation, no protocol or FSH brand clearly stands out in terms of live birth. Long agonist regimes may retrieve more eggs in some trials, but this hasn't been convincingly translated into more babies at home. Adding recombinant LH, which many clinicians still do for older women, did not improve clinical pregnancy or live birth rate in meta-analysis of 5 randomized controlled trials. Routine ICSI in non-male factor older couples did not outperform conventional IVF and may even be less effective when fewer eggs are obtained. One of the most striking findings concerned assisted hatching. In a meta-analysis of randomized trials in older women, live birth rates were actually lower with assisted hatching, but 19.6% compared to 21% when no hatching was done. PGTA, using the older fish-based technology, which is much older, did not increase overall live birth rates. The rates was 27.5% with PGTA and 27.2% without. It can reduce miscarriage and a number of transferred, but it's not guaranteed a shortcut to success. Newer comprehensive testing may do better, but evidence is still evolving. There are some positive signals. Culturing to a blastocyst stage can help older women when there are at least 3 to 4 embryos on day 3 to work with. A large cohort suggests that planning 3 to 4 cycles, especially in women under 40, gives a better chance of cumulative success. That is something which more and more studies are coming through. Prepare probably for 3 or more treatments once you start crossing 37 to have a reasonable chance of success, and that's what the evidence says. The take-home message for patients and professionals is this: advanced age definitely affects egg quality and quantity. More add-ons do not automatically mean better IVF. We need to focus on interventions to proven live birth benefit in this age group, and we need better trials at the end.